Welcome to another episode of I Wonder, Doctor.
I'd like to talk about how women can gain excessive weight in the premenopause and menopause, and men can do so at that time of life as well.
This is a bit of a surprise to me. When I think of menopause, what I think of is hot flashes and such, and well, we know what men think of. But weight gain?
Yeah, and it was a surprise to me because I'm a physician who's seen hundreds and hundreds and hundreds of women in menopause.
Yeah.
And I started learning that they didn't have trouble with the hot flashes. Yeah, they're a little inconvenient, and they're especially inconvenient when they happen in the middle of the night and disrupt sleep. I would say, from my interviewing women, the number one concern of menopausal women is excessive weight gain in all the wrong places.
So they were coming to you and they were complaining about lots of things, weight gain and such. Were they connecting the dots?
Sometimes yes, sometimes no. I mean, they come to a physician, they start listing the things that bother them the most, and I was early on aware that they're listing weight gain.
Right.
They may not know it's related to menopause, but that was one of their primary concerns.
So how? How is it related to weight gain?
In another I Wonder Doctor video, I've spoken about this enzyme called LPL, which in women is concentrated primarily around the hips, the buttocks, and the thighs of women.
Yeah.
And it's dormant in young women because high hormone levels that they have suppress it. But if a woman's hormone levels decline, and they can start declining as early as the early 30s, and significantly so. As those female hormones decline, LPL is unleashed and starts accumulating fat. In fact, if you're a woman who's gaining weight in those areas, buttocks, thighs, hips, in their 30s, there's probably a relationship to lowering hormone levels. You still have enough to have a period. Now, why do those hormone levels lower? Because of the stress response. I've always mentioned it, the vanguard of the stress response is insulin, cortisol, and adrenaline. Yes, sir. But other hormones can participate in it. For example, young women who are stressed, they can also add estrogen to the hormonal empowering mix, which means it's not going to travel down the female pathway. They're going to stop menstruating or have irregular periods.
Yeah.
So female hormones can get depleted from excessive biological response to stress. You can still have the stress in your life, but you want to learn how to deal better with it so you're not triggering the fight or flight aspect of it.
Yeah.
Here's another issue. Young women can start getting irregular ovulation as early as 15 years before they stop menstruating. And when you do not ovulate, you do not produce sufficient and robust amounts of progesterone. And progesterone is needed for the proper functioning of thyroid hormone. And poorly functioning thyroid hormone leads to slower metabolism and weight gain.
So if I'm hearing you right, a woman maybe even in her 30s should be seeking treatment for this.
Yes.
Is that right?
I am saying exactly that.
Yeah.
And one of the things she can do is she can educate herself about this because there's lots of good books have been written about this.
Yeah.
And another thing that she can do is seek a consultation with a physician who's excellent with hormones. They're out there, and on our website, I actually list a series of questions that a woman could interview the front desk person of a physician's office to see if that's an interest, a special interest, that that physician has taken on, because you want people who are that educated.
And you've just addressed an issue that puts off some alarm bells in this country, and that's hormones. You just said the H word.
Well, this is an extremely important topic that we're going to devote a lot of I Wonder Doctor time to. Let me just give you a sneak preview.
Yeah.
Oh, they're wonderful, and they just need to be done right to the right women. But they're wonderful. They can make a major difference. I'm a major proponent of them. Got to get it right. Got to go to people who are especially knowledgeable and experienced in administering them.
Got it.
And again, it's very helpful when a woman becomes informed about the topic. Lots of good books. I recommend the book I wrote on the topic, which I think is very good. And for men, you know, it's the silent issue. And if you're losing potency and erectile function, you connect up with one of these specially trained hormone doctors as well. They can do a lot of good for you. And also connect with the information of why you've got an excessive loss of your wonderful sex hormones. They're going down the stress hormone pathway. And there's a lot that you can do about that, as we cover in lots of different ways in I Wonder Doctor.
Great. Well, thanks.
Welcome.